Okay, so welcome everybody. This is the question and answer portion of our two-part Assertive Community Treatment training series. The series is sponsored by Access and is presented in partnership between the Western Interstate Commission for Higher Education and Advocates for Human Potential. The first part of today's session will be spent answering questions submitted through the survey link, and the second part will be spent answering any additional questions you may have regarding ACT. So please submit any of your questions through either the Q&A function of Zoom at the bottom of your screen or through the chat box, and we will make those available for you. I'll be monitoring the question and answer box and the chat box throughout the presentation and taking note of questions as they are submitted so that we can have our national expert, Ashley Durrell, address them as time permits. And with that, thank you. Oh, I just saw a question pop up. The first session's recordings will be made available through Access's website at some point in the future. So stay tuned, those are coming. And with that, I will turn our presentation over to Ashley Durrell, our national expert on assertive community treatment.
Thank you, Becky. Good morning, or well, good afternoon, everyone. Really great to be here again with you. I'm going to go ahead and jump right into the questions that were submitted so we can go on to the next slide. Thank you. So question one is, does ACT fidelity require that an ACT psychiatrist have 1 year experience? And also the second part of that question is, can they have a nurse practitioner? Next slide, please. Next slide, please. So this is something that I did go over during our first session. So we have this kind of dream team composition. In each little box, you will see that everyone has a role. There's the team leader, the psychiatrist, the psychiatric nurse, employment specialist, and several other staff members that can compose an ACT team. So for this one, we do want to say that no, there is no experience that is mandated. You have to have 1 year. There is nothing that says that. However, there is not an allowance at this time for a nurse practitioner. At this time, the only person who can hold the role of psychiatrist on an ACT team is a psychiatrist, a medical doctor. So of course we could be hopeful that in the future, this would be allowed to maybe ease up the hiring process. I know sometimes it may be challenging finding a psychiatrist with interest and experience in this area, but at this time, we do need to make sure that we are working specifically with psychiatrists and not nurse practitioners. Next slide, please. Question number 2 is there a maximum number of members an ACT team can intake per month? So if we go on to our next slide, we'll see that based on the fidelity scale, the highest monthly intake rate in the previous 6 months was no more than 6 consumers per month. So our maximum intakes per month for an ACT team following fidelity is going to be six consumers per month. So next, we were asked, how many members can an ACT team serve? So when you are considering an ACT team, it's suggested to have a team of 10 to 12 FTE positions with a caseload of 100. Next slide, please, Becky. And if most of the consumers that your team works with require frequent contacts, you may want to reconsider the staff to consumer ratio, and consequently the total case size may need to be smaller. The same is true if consumers are living in conditions that are chaotic, such as housing is hard to secure, daily living is very stressful, or if most of the consumers have co-occurring substance abuse issues or complicated medical needs. So this slide reiterates the ratio. So the ACT teams are considered to have small caseloads, keeping in mind this is not just a case management services model. Case management is just a small piece of the services that you will be providing. And consider this to be a 10 to 12 staff service, approximately 100 to 120 consumers if you're going to have 12 staff. And keeping in mind, you want to keep it around 1 to 10 ensure that you are thinking about the needs of the consumers and your ability of your staff to appropriately and ethically serve those consumers. And these are shared caseloads. No one is going to be working consistently with one client. You're going to be making sure that each team member can touch the consumers on the team. So if we go on to question 4, we'll see that does a member have to agree to act level of care? And the answer is yes. Of course, there will be small caveats to this, but you do want your consumers to agree to the level of care unless they are maybe a ward of the state. They'll have a guardian or conservator that is going to consent to or sign items for them. But we do want our consumers to be in agreement. We want to always put our consumers first. We want to make sure that they have choices and they feel that they have choices. And this is something just also to note. Next slide, please, Becky. This is also something to note that the ACT model does not advocate using coercive measures. Some suggest that there is a fine line between assertive and coercive treatment, of course, being that this is called assertive community treatment, but using coercive measures fails to recognize the fundamental value of consumer choice and the rights in consumers to share responsibility for their recovery. Also, we don't want to re-traumatize individuals who are in the mental health system. Coercive measures are going to elicit fear and mistrust. So again, this is something that you really want to train your staff on. You want them to be very aware of what that fine line is and be able to use creative measures to engage consumers in treatment and utilize creativity when thinking about interventions. But we always want to have consumers have their voice heard, and we also want them to always consent to their treatment services when possible. Of course, there will be some circumstances, maybe if there's a legal recommendation that they need to be participating in ACT services, but of course, the client can choose not to, and they will have to, deal with those natural consequences. But always make sure you're putting the consumer first and their choice and their needs. Next slide, please. So does ACT have admission criteria? And absolutely, we do have admission criteria. Next slide. So this program actively recruits a very specific defined population. All consumers meet the explicit admission criteria. And just to briefly go into some of that criteria for ACT programs, you should be targeting consumers with mental illnesses that seriously impair their functioning and community living. You're going to give priority consumers with schizophrenia or other psychotic disorders like schizoaffective disorder, bipolar disorder, because these illnesses more often cause long-term psychiatric disability. Consumers with a primary diagnosis of a substance use disorder or intellectual disabilities are not considered appropriate. So again, that's just for folks who have a primary diagnosis of substance use disorder or intellectual disability. They are not considered appropriate for ACT services. Next slide, please. So can an ACT team refer members out for services if needed? And so this one is, you can refer people out. Next slide, please. You can refer people out, but achieving the right mix and number of professionals on the ACT team is one of the essential pieces of having your staff meet the needs of the consumers that are going to be served. The ACT team should be able to serve as the primary provider of comprehensive services. And this is, if we go back to slide number 3 with the dream team composition, you're going to see that you have that ACT team leader. You have the psychiatrist, a psychiatric nurse, employment specialist, substance abuse specialist, a mental health consumer or peer specialist, program assistant, and additional mental health specialists. So this is a pretty large team, and we are composing the team of this many disciplines to ensure that we are able to provide the most support, that we are avoiding referring people out for services, and that we can maintain our role as a primary service provider. So again, yes, you can, but it is not necessarily recommended or preferred that clients on an ACT team are going to be referred out for services. And then if we go on to question number 7, does the ACT team see members on weekends and nights who are in crises? So if we go to our next slide, we will see the core service components of an ACT team. And one of these main core service components is crisis assessment and intervention. So when we're looking at our crisis assessment and intervention, that is going to include the expectation that ACT teams are available 24/7 to their consumers. Next slide, please. This also goes into the piece of, are we going to be referring out? So no, you're not going to refer out for crises that happen at 2 a.m. Or that happen on Saturdays. You are going to have members of your team who will be able to serve your clients. These are time unlimited services. Consumers will receive these services as long as they require them. We want to ensure that we're flexible in our service delivery, which also leads us into the 24/7 access to the team. And also, if you are working with your consumers consistently, if you are having your morning meetings and all staff are really privy to what is going on with our clients and servicing them consistently, you can mitigate a lot of those challenges that may come up and be seen as crises. We want to make sure that we're learning our clients' needs and we can serve them appropriately. So that ends the questions that we have had submitted through our survey online, but we did want to open it up to see if there are any additional questions that we may be able to address while we are on this afternoon.
So please feel free to submit those questions in the chat box or through the Q&A box. But Ashley, one question for you while we wait for other questions to pop in. If you could give one piece of advice to an ACT team that may be struggling a little bit in any way, shape, or form, what's one piece of advice that you wish all ACT teams knew or had or could think about?
I think that one of the most important pieces is having a cohesive team. Making sure that your team members can work well together. There will be differences of opinions because you have multiple disciplines within the team, but really understanding how to overcome those differences and see some of the responses through various lenses when you're working with the clients. I think that the cohesive team piece is something that I experienced when working on an ACT team that was extremely helpful. To have the ability to communicate openly, understanding that sometimes there will be some challenges or some disagreements, but having an ACT team leader also who can help facilitate and navigate through those challenges with the clients, and really kind of spacing it out, understanding when people which are staff on your team are maybe at a point where they need to take a break from a client. So that roundtable approach is always super helpful when you're working with some clients that may be a little more challenging or may have limitations on who they can and will interact with on that team.
Awesome. We've got a couple more questions that came in through the chat box. One question is, what are some strategies to help ACT members gain competitive employment?
I mean, really having the access to the employment specialist on the team will be important to help them gain the competitive employment. So you want to have someone who has a strong ability to understand employment specialties for individuals with mental illness, and then also providing that support. And as far as being on an ACT team, you should be making contacts every week with individuals that are a part of your consumers support network. And sometimes that may include supporting them as far as work. If they don't show up to work, maybe it'll be that you go out to the home, you have a staff go out to the home and see what is going on to help them maintain that employment once they get there. But then also really listening to the consumer and understanding what their skills are, what some of the barriers are for them to work. Are they not good with people? Do they love people? So really having a good amount of knowledge on where your consumer can succeed. And of course, the only way to do that is to really include that consumer voice and not try to push them or coerce them into jobs that are just available to them, but or may not be the best fit.
Thank you. So another question is, when the requirement is team access 24/7, does that mean that all positions have access to each member type 24/7 or only one person?
Ideally, it would be one person. When you're looking at staffing your ACT team, a big portion of this is scheduling. So you want to see how you're gonna schedule this. Are you going to have rotations with staff members? Maybe there'll be a week on call, if that's what you want to call it. Is okay. So Becky's going to be on call for a week. So we know that from 5:17 to 5:24 or whatever. Becky will be responsible for answering calls that come in from 6 p.m. to 6 a.m. the following day. Typically, you do want to have that one person. They'll be able to report out any issues the next morning at the meeting. And then you will have the opportunity to maybe work with consumers during traditional business hours to help mitigate any issues that would arise. But yes, it would be ideal that there is one person that is going to answer those calls at a time and make sure that you are spreading the wealth on that, not burning out any one person. But it would definitely behoove the team to have that one person access the clients via phone 24/7. They should have a direct line number. It shouldn't be necessarily an answering service that's going to filter the calls. It should be a direct line to one of the ACT team members.
Awesome, thank you. Another question that popped up was ideas or suggestions for rural areas regarding ACT teams where there may be a limited number of required ACT positions. And this is a tricky one.
Yeah, so a limited number of required ACT positions. I think that's the piece I would maybe like a little bit of clarification on.
Hang on
And
just a
Becky,
second.
if this,
That question, Judy, I'm going to let you talk in case you want to expand on your question just a little bit. So Judy, you should be able to unmute.
Thank you. Just Arizona has many rural areas, and to have a complete ACT team sometimes gets to be challenging, even when they do their best to bring in folks that come from other areas. Weather, distance, all those things take effect. And while it's everybody's intent to do what they should be doing, just any experiences you've had with other states or other areas where they've had extreme rural areas, and what have they been able to do, or any tips or suggestions they have for how to recruit people, those kind of things, because I think that is a huge challenge for Arizona.
Okay.
Thank you, Judy.
Yeah, thank you for clarifying. I think that, of course, there's a couple things, because one, an ACT team would be ideal in some ways for a rural area because you would be that sole service provider. So you don't have to worry about necessarily having access to all these other services because your team would be robust. But of course, recruiting folks to come to a rural area or finding folks that live in a rural area can be a challenge. I don't think that there is anything that I could suggest that maybe would be outside of the box that would be helpful to answer this particular question, unfortunately. But I would just, of course, focus on folks who maybe have an interest in working in rural areas. If there's any particular job forums that would allow you, that are focused on rural area employments, that may be a good place to look and search. I know there's a lot of different job boards that exist, ones around diversity and things of that nature. So looking at something like that may be a helpful piece to recruiting those individuals for those hard to reach areas.
Thank you. We got another question regarding referrals, and that you mentioned the team takes care of everything. Isn't it possible that a person needs specialty behavioral health therapy outside of the team? Also, does the referral prohibition not apply to physical health care services, labs, and diagnostic tests?
Okay, so yes, again, we do say yes, referrals are allowed. They're not ideal in certain circumstances. But of course, if someone needs labs or diagnostic services that fall outside of the mental health range, if maybe they have cancer, they need an oncologist, of course, we want people to receive the services that they need. And if there is a specialty outside of what you can provide as a team, you will be referring them out. But you do just want to make sure that you're building your team to the capacity to where they can serve the consumers and meet a lot of those basic needs, including substance abuse treatment, employment specialties. Of course, there should be someone on the team who can deliver therapeutic services, but maybe they're not specialized in cognitive behavioral therapy. And that is something that is really going to work for this client and is being recommended by your psychiatrist. Then at that point, yes, you would be able to refer them out. And there is no true prohibition of referring people out, but when you're considering fidelity and you're considering the best way to serve the client, you're going to want to be able to be as comprehensive as possible.
Thank you, Ashley. Those are all the questions that have already been submitted. Are there other questions? I certainly don't want to keep anybody longer than we need, but I also want to make sure that we take the time to address any other questions that you may have.
Yeah, and those were some really great questions. So thank you for, feeling free to pop those in. And I hope that it was helpful to hear some of the responses. I know one of the main challenges would be finding individuals to work in a rural setting. So I do apologize. I did not have anything super amazing for that one. But I definitely, it's definitely tough. And I have been in a space of working in cities mainly just because of my personal preference of living in large cities, which probably a lot of folks have. So hopefully there will be some job boards and looking in diversity hiring that can definitely help fill in some of those gaps.
Absolutely. And it's, that's a struggle across the West. So the workforce development is something that is a struggle kind of across the western part of the country, but especially in some of those super rural and remote areas. Are there other questions from anybody? Ashley, I've seen a lot of things pop up around the team approach and assigning staff to caseloads for documentation purposes, but then teams that may struggle then to differentiate the team leader, the case manager for documentation purposes versus the whole team working with each individual client. Do you have any advice for how to merge those two and to make the team approach easier, or ways to operationalize that, ways to make that work?
Yeah, so just based on a team that I've been on, one of the things that worked well, we were all assigned, we had like 10 clients that we, were assigned technically within our electronic medical record system, and that we were responsible for. But the purpose of those caseloads was not necessarily for the daily documentation. Of course, if I go see Tom today, I'm going to document that interaction. If Vanessa sees him tomorrow, then, she's going to document that. But as far as the consistent documentation that needs to happen for these clients, the things like the treatment plans, and maybe annual assessments or first-time assessments, that individual that is assigned to them will handle all of that documentation and ensure that it is in place. And I think that gives the team member enough responsibility to really kind of own that client and know them in a space that still allows that roundtable approach where they don't feel like they have that ownership over the client, which can be a bit of a challenge if someone is shifting from maybe traditional case management where all the clients are your clients and you work with them specifically and you build that rapport. So you have to keep in mind that if someone's transitioning from that type of role, that there's going to be some struggles, but clearly defining the role and the responsibilities around your, 10 clients that you are assigned to is going to be super helpful. So maybe, like I said, making sure that consistent paperwork that needs to be turned in, maybe ensuring that the files are up to date for that person, that's going to fall on that primary kind of team member. But it will not, lend itself to the day-to-day interactions.
Awesome. Thank you. That was really helpful. I hate to keep the meeting open if we don't have any other questions. Are there, but I want to make sure that I don't cut anybody off. Are there any other questions for Ashley while we've got her here? We'll give it another minute or so, but if we don't have any more people pose questions, I'm starting to see people drop off. So this may be it. I just don't want to cut anybody off. I want to make sure that we give everybody a chance to ask all their questions. But if there aren't any more questions, then we can certainly give you back an extra half an hour of your day.
Yes, that is always, I'm sure, ideal for everyone to get some time back.
It
We
is,
never have enough of it.
Never, but I don't want to cut anybody off or to take away opportunities. Absolutely. So we'll give it another minute or so in case anybody thinks of any other questions. But I just keep seeing people drop off. So this may just be a Wednesday slump of, it's been a long week already. Do you have any advice for how the team leader can protect their time to do some of that direct care instead of just, and how to balance the direct care versus the administrative role of being a team lead?
I think one of the best ways to do that is to really optimize the use of your program assistant. The program assistant is a part of the team who is not going to be responsible for seeing clients. Their primary goal is to help support. So that'll be maybe scheduling appointments and helping keep track of, daily meeting notes and things of that nature. So there is I think there's a good portion of administrative tasks that can be passed off to your program assistant that will allow the ACT team leader to ensure they're meeting their responsibilities in direct client services.
Awesome. Thank you. That's a really good tip.
Yeah, definitely program assistants are super helpful. I have been able to work on an ACT team where there was a time where we had no program assistant, and then there was a time where we did. And once we got that role up and going and we got in our groove, that it really changed the game.
That's fantastic. Thank you for that. Any other thoughts or things that you wish teams would know and think about ahead of time?
I think one of the main things is really focusing on being creative and putting that client voice first and understanding some of the rationale and understanding the symptom presentation. I think that's really important. And when clients are not necessarily being quote unquote compliant, understanding where that may be coming from, to not just see it as a lack of compliance, but see what are the underlying reasons for that. And also really supporting them in connecting with members in their community and family members, having that family member be a part of the team, working a lot around the educational pieces for other support members of the consumers network. I think that is one of the most important things. We put a lot of energy into kind of fidelity and the rules, which are they're really important and they're going to help you be successful. But another piece is really focusing on that relationship building with your clients and empowering them to have other people involved in their treatment that are there and able to support them.
Awesome. Well, thank you for that. That was a lot of really helpful information, and no other questions have popped up in the chat box. And let me check, and none in the Q&A box. So I guess we can be finished a little bit early today and give everybody back a half an hour of your days. But thank you everybody for taking the time to participate. And thank you so much, Ashley and Vanessa, for making time to talk to us today. And we appreciate your participation and your time and expertise. So thank you.
Thanks, Becky, for having me. Hopefully everything was helpful.
Let's go.
Yeah, have a great day, everyone.
Thank you. Thanks, everybody. Bye.